Okay, today I am going to go through how to assess for hypermobility or too much range of motion through one of the joints in your foot. So your metatarsal phalangeal joint, or the joint where your big toe meets the foot, is what we're going to be looking at today. Now you might be thinking, what does that have to do with personal training, or what does that have to do with a client performing lunges or deadlifts or movements like this? But it actually can play a really important role, because if you have instability at anywhere throughout the body, at a segmental level, it can actually cause issues with compensation throughout the rest of the body. So this is a really common one that a lot of clients have hypermobility through, and it can create a lot of problems during lunge patterns especially. One of the more common compensation patterns you'll see is the back foot rotating into a bit of external rotation in an attempt to give the client more stability. And so this can increase risk of injury, can cause the muscles you're trying to recruit to not be recruited properly, so you're not actually working the muscles you want to be working. And it can wind up causing issues with your client being able to progress to more difficult versions of primal patterns. So in a second, I'm going to show you how to look at assessing this joint. It's actually an incredibly simple assessment to look at. Okay, so what you want to do is look at the client's foot and then have them go up into kind of like plantar flexion, so up like that. So they're lifting the heel and going up onto the ball of the foot and the toes. And so what you want to look for is, if the person has healthy range of motion through their joint, you're going to see the foot go straight up and down like this. So you see how the foot stays vertical. If they have hypermobility, what you're going to see is the foot's going to go off to the side like this. So I'm doing a very exaggerated version of this. It might just be slight like that. So what you want to do is just have the client go through this range of motion a few times, see if their foot goes straight up and down like this, or if they have hypermobility and it's going through that range of motion there. If they have that hypermobility, you want to learn how to address that issue and get more stability through the foot. And then this way they're not going to be having compensation patterns come up in other patterns like lunge patterns or squatting patterns, which will create issues.